Hey guys, I'm Dr. Scott Hadley with MyoReflex. Perhaps you've already read the ebook, or maybe you've seen some of my blog posts on how to roll the soleus, the quadriceps, and the glutes using the MyoReflex Roller and a ball. And in this video, I want to take a few minutes to explain those a little bit further so that you're not just looking at pictures, but you're actually seeing a video of how to do it. So let's start first just by rolling the soleus. If you have the MyoReflex Roller, awesome. If you don't, you can try this with a rolling pin. It doesn't work as well, but you can try it. And I encourage you to just invest in yourself and get one of these because it really does work better than a rolling pin or any other tool for rolling the soleus in particular. Now, the soleus is this large muscle that occupies most of the bulk of the back of the calf. The gastrocnemius sits up on top superficially, but the soleus is this really huge muscle that fills the bulk of the calf, and it's the most powerful muscle in the calf. The best way to keep the soleus limber is to start with the MyoReflex Roller down over the Achilles tendon, and it's perfectly spaced so that the Achilles tendon can fit right between the grooves of the wheels. So start with the roller down by the Achilles. Relax the foot, and using your opposite foot as a pivot point and both hands as a leverage point off the floor, you can lift yourself up, forming a little tripod, and roll from the Achilles tendon about 2/3 or 3/4 of the way up the midline of the calf. You don't need to do this fast. You can go as slow as you want. Slower is probably better than fast. If you're going too fast, you'll just bump over the tight spots that actually need to be loosened. Now, if this isn't enough pressure for you, you can cross your opposite leg over the leg that you're rolling and use more of your body weight. So the soleus is a very dense muscle, and it's one of the primary shock absorbers. So it gets a lot of use, and when it gets a lot of use, it fatigues, and when it fatigues, it stiffens. So we've got to keep this muscle limber. After you roll the soleus for about 1 to 2 minutes, you might as well do it on both sides, you can focus your attention in on the quadriceps. Now there's really 4 muscles in the quads. We're only going to focus on 2 of them. The 2 muscles that we're going to work on primarily are the vastus medialis on the inner side of the quadriceps and the vastus lateralis on the outer side of the quadriceps. The vastus medialis is kind of a teardrop shaped muscle that attaches to the inner side of the patella and extends all the way up through the femur. So to really get to that muscle, you have to hold the roller almost completely vertical. And you can put a lot of leverage through if you're sitting down on a chair with your knee bent to about 90 degrees. And if you have your shoulders right over top of the handles of the roller, you can really dig in deeply into the vastus medialis. You see it kind of lumping around underneath the roller. It likes that, and it needs that, because it's a difficult muscle to stretch, because the knee just doesn't bend far enough to really allow this muscle to stretch. So digging into it deeply is really the key. So you're really just working the bottom half of the thigh right over top of the vastus medialis. Now there is this bottom margin of the vastus medialis that oftentimes needs a lot of work. There are a lot of trigger points that develop in there, creating pain that is generally felt in the front of the knee. So after about 1 minute there, you can move over to the vastus lateralis, which is really the powerhouse of the quads. It extends all the way from the hip down to the lateral side of the kneecap and wraps even around the back of the femur. So when you're working the vastus lateralis, again holding the roller almost vertical, you're rolling right over top of this structure that everybody knows as the IT band, which is just a connective tissue structure that covers the quads. Most IT band pain is not actually a problem with the IT band, but it's a problem with the vastus lateralis. So you can really generate a lot of leverage pushing through the 2 handles of the MyoReflex Roller. If you need more leverage, you can cross one hand underneath your thigh and hold the other handle and kind of stabilize the bottom handle and put all of your pressure through the top handle. And you can dig deeper than you ever really wanted to dig into this muscle, but it's very effective. If you do have a tight IT band, this will for sure loosen it. If you have pain in the lateral side of the knee, it's likely coming from the vastus lateralis, not from the IT band. So we've covered the soleus, vastus lateralis, and vastus medialis. The fourth muscle is the gluteus medius. Here's the top of the femur. It's called the greater trochanter. Here's the top of the pelvis. It's called the crest of the ilium. And the gluteus medius lies right in between those two structures. It attaches here and it fans out upward to fill this whole space right here. It's a big, powerful muscle. So it really kind of fills the whole lateral side of the hip and also part of the back side of the hip. So the best way to really dig into this muscle is to get a ball about 3 or 4 inches in diameter, and we're going to stick it right there, and you're going to sit on it and roll back and forth, side to side. We're going to find these landmarks. The first one is the top of the pelvis. It's actually above the waistline. Most waistlines fall below the crest of the pelvis. So it's way up here, and the trochanter, you can feel this in the lateral side of the hip, right about there. So you have this little 6-inch window, and that's where the ball is going to go, and slightly behind the midline of the body. It's easiest if you start with the ball. If you start kind of in a, what's this position called? Crab walk position. And if you place the ball underneath the top of your hip, this is not the part of your hip that you normally sit on. We're not going all the way down here. We're rolling up closer to the waistline. And once the ball is in place, you can let that leg fall outward, and you can gently start to roll side to side. If you don't feel that, it's likely that the muscle's too tight, and so what you can do is lay down on your side, taking your weight up through the same elbow on the elbow on the same side of your body, and then let the ball find this little crease between the top of your thigh and your pelvis, and you can work side to side this way. If it's painful, you just need to go a little bit slower. If you find a really painful spot, you can just kind of hold still there and just let your body relax over the ball, and then gently start moving side to side. So about a total of 1 minute, maybe 2 on each side. Now, the sequence of rolling is important. It's best to start with the soleus, and then do the quadriceps, and then the hip. And then if you're having pain in any of those areas, repeat that same cycle, soleus, quadriceps, hip. And as you repeat that, the muscles gradually relax because they're all connected reflexively. These 4 muscles, the soleus, the vastus lateralis, vastus medialis, and the gluteus medius, are the 4 muscles that create 6 of the most common running injuries, which I call the dirty half dozen. If you'd like to learn more about that, you can look at my blog posts or download the free ebook, The Secrets of Pain-Free Running. So I hope these videos helped you. Make sure you get a ball, make sure you get this roller, or if you don't want to invest in buying one of these, you can try to find your mom's roller from her kitchen. All right, well, thanks for watching, and enter any comments below, and I'll be happy to answer any questions. Thanks a lot.